times.
Why?
So your angle is going to be about like that, about a 45-degree angle. So when I first start, you're going to touch with your blade.
I'm going.
Add a little bit of pressure. Yeah, hold right behind the blade. Add a little bit of pressure.
So it wants to be a
And
little
now
smoother
drag.
than flatter, right?
Just like you're peeling a peach.
They should have those eye things.
Isn't that cool?
Yeah, that would be.
Yeah,
Yeah, those little things that they sort of just put on like little goggle kind of
I
things.
can do that for
Yeah.
you.
Right? That you're not flat, but you're not straight either.
What did she use? Does she use same thing to?
And then
Have you ever seen the old movies where the
and a little
other man is like shaving the other man? That's what I read.
That's slower, it's smaller.
You can use a little
There you
more
go.
pressure. Don't lift up, just glide back.
And then usually a little close.
So you're going to pull up with pressure, glide back with no pressure.
Hmm.
So keep going up or the.
Once you get a little pile
Yeah,
going,
okay, so then
Yeah,
then you
so
can scrape it up onto your blade. Just scrape it onto your blade like that, and hold it down with your finger, your other finger, your thumb or something, scrape it up onto the blade and hold it down, put it on the tissue.
So you're not going sideways.
That way you build it up and let them see it all
Down,
at the
and then
end.
you're coming back up.
So start from here now?
It doesn't matter if I start here or here, does it?
Not usually, but I usually try to
The
start
skin
in the
color
middle, and
changes
then
too.
work around and then go back to the other side.
So you could slow down and use a little more pressure.
That's
So
6
I like to really
passes,
think
is
when
that
I'm
right?
doing this, so I touch down,
Yeah,
and then I
instead
push
of like-
down,
I
and
have
then I
that.
drag.
I don't know how to explain it.
And we
like
would try
here.
no pressure.
So,
Yeah, you glide back with no pressure, come up with
so
pressure.
whenever you do come, a little bit pressure down.
Now you're scraping a little bit. And her skin, you don't have to worry about it too much, but people with really dry skin, you have to be careful how many times you go over the same area,
Okay.
because you have to think every pass, you're creating an ablation.
Okay.
So if you're working on fragile skin, which hers is actually not fragile, but if it's fragile, you can wind up with that.
Yeah. Little
Especially on the
spot.
forehead. So you have to, especially you're heavy-handed,
Am I?
a little heavy-handed,
Okay,
yeah,
okay.
which is fine. But you just don't want to use as many passes over the same area too many times, right?
Full face.
And it might be easier for you if you put your finger right there. There you go.
Are you a
Now,
esthetician?
you want that
I thought she
That
said something.
angle right there.
Okay.
Press down and now drag up. See how much more dead skin you're getting on here?
Yes.
It's
How
hard to
many?
see
8
under the
years?
hair.
Did you get licensed here in Georgia?
But when you go back over a second
yeah.
time, you're going
Yeah.
to pull off more dead skin cells.
Yeah.
You just have to be
What is
careful
the
when you
EA?
get on the bony areas. If you go
I'm sorry,
over it like
which one
this
is
too
the
many
EA?
times,
It's right here.
then you'll nick the
And
client.
then-
But on the
it is
fleshy
pretty
Yeah,
areas,
my neighbor
you
right
don't have
there.
to worry about it quite.
I went to
Other side, go over there.
She knows very nicely. Your moves are very nice and small. Just do little pressure, it's fine.
You don't want to press it too hard.
Yeah.
So
It's going to be difficult.
Don't do anything there. Don't frown. No,
I
not at all.
can't work with magnifying lamp. I always work with glass.
Okay.
because your eyes are sensitive.
I don't know, just
So
like
I like to use two probes, and there's two size probes also. So you can, the small ones are for capillaries, and then there's a bigger one, which usually you'd use on skin tags. I'm going to try the small one here because it's what I've
Oh,
got.
look, she's got one right here too. We should just go in and take. Oh, look, she's. This
Seriously?
is great.
Get this done.
Everybody can do a. Bzz.
So just stay over like this.
Oh, you don't hear it.
What did you feel? Electric
Little
shock?
electric shock, yeah.
All through your body or just right there?
Just right there.
Is there a certain power or strength you put it on in the machine? Because doesn't it go from different?
It goes up to 10. I have it on 8.
Oh, okay.
You for this type of thing, you're really going to need more power. Capillaries, you don't need, that.
Oh.
But we have a
Like
training
old
manual.
woman
Oh,
with
okay.
this, that. Look at your skin. Good. Oh, I have to check what was that. Okay. Is she trying to remove those? Will it work?
It is working. Now they'll scab a little bit because you don't. I mean, it's better to just be light-handed and not scar people.
But it looks lighter.
Yeah. So that part is supposed to fall out of her skin towards your neck?
It should dry. It should get dry and fall off. Now, I don't think all of it's going to fall off, but I think what you're going to see is closer to the skin.
I see. Instead of being hypertrophic,
Yes.
kind of sort of flatten it out a little bit. I feel like I have I think Sarangomas, but I don't know that those respond in that same way. And then I wonder, since I'm on the table getting a consult, what about like these areas right here that are very hyperpigmented, right around? I noticed when you had Arkita on, she was a little hyperpigmented, but I guess obviously the darker you are, the more pronounced the hyperpigmentation.
That's what the peels are helping.
Oh, okay.
And gradual, right?
Gotcha.
So that's why you want people
The-
doing peels at home.
The glycolic peel, the glycolic wash.
But estheticians can use this because we're not puncturing the skin. So it's a probe, it's not a needle. And we're just using a tap method.
I think that's great because it's safer.
It's much safer than a hypercator.
So, like, a nurse practitioner could use that, I would think, right?
Oh, sure.
They probably,
Esthetician, nurse practitioner.
nurse practitioner also probably can do like Botox or something. No?
Oh, sure, yeah.
Yeah, they can.
They can do everything a doctor
And
can
fillers,
do.
like.
Okay, so we have the serum. This is a 03, so these are actually pretty long needles for sensitive skin. So remember, we're going to roll in that pattern. So we're going to do cross hatch, and then we'll do in between the cross. So I'm going to count to 6, and a couple things that I just want you to pay attention to is the way I hold the roller. So you're going to see different people do it different ways. Some people just overhand it like this, and they roll like this, so that all the effort is in the shoulder. That's fine. What I notice when I roll that way is it's hard for me to get much pressure on the barrel. So what I do is I hold it underhanded like a chopstick. And what this does is then when I put the barrel down, that turning of my arm, it puts a natural amount of pressure onto the tissue. And then the action is in my elbow, not my shoulder. And so it's much faster. So we'll start with a small section. I also can put my finger out here, which gives me a little more security, or under here, either one. So, and I count to 6. That's just a habit I've gotten into. So I want to do at least 6 to 12, 6, 8 to 12 passes. So I go 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6.
So when you said that you do chemical peel with that lactic peel basically, and so each patch you do it and then remove it, or you just once you finish this area and then remove it?
Yeah, so you do an area or a
Okay,
zone.
and then remove it.
I would, if if I had a peel on the skin, I'm gonna be it's a little more work.
Yes.
So I would take this section of the face.
Make
and I
it
would-
3 parts
I
or
would break it
something.
up into
Yes.
4 parts. So I
Yeah.
would break it in half
4
here,
parts, right.
and then I break it in half here.
Okay.
So I just do this section right here.
Right.
Put the peel on, needle it with the pen or the roller, either one, and then I would remove that.
Yes. Okay.
Now, I don't take the time to go back and rehydrate it right now because it slows me down too much.
Right. You can
But I
rehydrate
just
later.
remove the peel with
Okay.
cold water. And I
Yes.
would go to this section, and then this section, this section.
That you neutralize with baking soda or just it's okay
The
with the water?
peel is
first?
not going to be a high enough concentration to require that.
Okay.
And I don't want to completely neutralize the peel either. See, the
Okay.
water will neutralize
Yes,
it,
right.
but it won't completely
Neutralize. Okay.
stop the peel altogether, whereas the baking soda just completely cuts it off.
Okay.
So I
Yeah.
want that, I'm doing this to get activity in the skin. I just don't want there to be an over-inflammacious response. So
Okay.
I'm very careful doing the peels and the needles together.
So you would always break it up into 4 sections. You couldn't just do it one direction the entire cheek and then do a second direction the entire cheek. You would always want to put it up into little bitty parts.
Well, time is money, right?
You have to
So if you're not working, you want to finish one section, get it done, move on to the next section, get it done, move on to the next section, rather than go back.
Okay. You may forget too that, oh, did I do 2 passes or 3? So the one place it's better to get done and then move to
Okay.
next
It's going
one.
to be a little more sensitive, right?
Now, since she has the erythema, once you do all the passes, you could probably see any area on the face that
That you
you
didn't
might have
get.
missed, and you can go
Yeah.
back and get it.
So
And
that would be-
sometimes there's a little, it's hard, this section right here, it's hard to get it to flare up. So,
'Cause it's
or to
bigger.
flush, so usually I have to go back right here. Very easy around the eyes, as you can see. And the more passes, if I were to go back and do another set of passes, you'd start to see the blood weeping through, even with an O3. You can get into the blood. But with skin like hers, that's really not what I'm trying to do. What I'm trying to do is just get circulation, detoxification, oxygenation, stimulate fibroblasts. I'm just trying to get the skin excited so that it actually starts to get stronger. I'm not trying to break it down to the point of like I've got bad hyperpigmentation or bad scars or things like that. That's not the goal here. The goal here is to strengthen her skin, not to break it down.
No, that's okay. So go ahead and get
You don't have to add a lot of pressure.
Am I putting too much
that.
pressure?
It's fine. I know, it feels picky, but it's supposed to also be.
So when you're anchoring your work, as
Yeah.
opposed to being back here, your hand is always going to be close to your work. So you don't have to stretch it, just anchor.
Okay, just
Stretch it on my side.
Oh, is there one over there?
Uh-huh.
Here.
Okay, and then the tissue to dry her.
Yeah, nice.
And back up a little bit on this so that you can get a little bit of security there.
This.
Maybe put that top finger right on the top of your nose. That'll make you feel a little more secure. And when you're anchoring your work, you want to anchor it kind of close to where you're working.
Okay.
There you go.
Sorry. It's okay. Good. And then we'll move on.
But you didn't do a complete star, you just did a cross. You went like this, and now you gotta go in between, so it keeps you on the tissue
Is
a
it
little
pink?
longer.
Okay.
It's like pink, yeah.
Lower. And so why do you wanna go lower? Well, I'll show you when I hand out the cartridges. And low again. So you've got 5 vibrations off and on. And then you have different cartridges. So we'll pass this out. The 36 cartridge, this is 36 needles in this cartridge. And I use this for superficial spot treatment. Because when you're treating hyperpigmented lesions, you don't want to go down into the blood because the melanocyte cells actually live right in the basement of the epidermis. If you draw a lot of blood to that, or if you wound it to the point of bleeding, then you're just going to wake up the melanocyte cells, and you're not going to have a really great outcome there, and you may even compound the problem. So I use a wider surface of needles. If it's on the cheeks, I use a little bit lower. Together. Now, this is an 05, and on the forehead, because the skin is thin, I'm already starting to see just a little bit of blood coming through here.
And going over here, was it a 05 or a 3?
It was a 3.
3.
I'm finding how forehead will be more kind of blood will come.
Yeah, because it's like, because the ones that are like different. What pattern are you using?
Well, you can basically, and then when the skin gets dry, it drags, so you can't keep going. But the pattern is more like a microdermabrasion pattern.
So that makes it easier. It'd be faster.
Yeah, I think the
than
pen is a
yours.
little bit easier to use. It's, you know, and then on your stubborn areas, especially with the 36 cartridge, you can do these little kind of half circles, and that helps to pick up the skin a little bit more. So, you got to give those needles time to grab the skin.
How close do you get up to the eye? Just, you know, I see the little
You can get close.
checks every time. Like, you know, I guess, because she doesn't have the wrinkles around that area, right? It's not as important in her treatment plan. Or,
Well, if we
prevention.
talked about prevention,
right, prevention.
you know, if that's something that she's concerned about. Now, you know, what's exciting for me about what I'm seeing is that we've induced a good bit of inflammation into the skin, yet she's not logging a complaint. She's
Exactly.
resolving fairly normally. She seems pretty comfortable.
Exactly.
And that, to me, is a good sign that she is going to repeat the treatment, have a good result from the treatment, and she'll see the hair follicles get more clear. She'll see the acne start to resolve, and the skin is actually, so it's anti-aging as well as going to resolve the acne and the clogged pores. But just do this part of her face, and then we'll do the
Like sandpaper, I
and your.
guess.
Now it's everything calmed down.
You're at about a 5. I think that's.
I don't
think it's
feel
good
any
enough.
smell of burn, not itching,
Oh, that's
tingling.
fine.
No, it's like it's healing itself.
Oh, okay.
Just kidding. Yeah, we're out. How'd that feel? I got all of
Good.
it.
Mm-hmm. And then all 3 areas.
Beautiful. That's nice. So you've got a nice even
What
flush.
do you
You're
think
probably
right there?
missing a little
Yeah,
bit right
I
there.
see. Yeah.
A little bit higher on your arm up here, so we'll have room to put the 201 and the 301 peels on your arm, so you can see. So let's start with these. I will tell you that the peel prep, I do not recommend doing that on new clients. It's a harsh prep treatment prior to a peel or dermaplaning, and if you're doing that on new clients, it can scare them, right? Too much too soon. So the microlifting peel is a fruit enzyme ascorbic acid peel. It's designed to use, you could use it with microneedling, you could use it with microdermabrasion. It's more for sensitive skin. You could use it as a first step into 301. The classic peel is your 7% Jesner. The perfect lifting peel is your 14% Jesner. And then the supreme lifting peel is your 20% TCA. So this is your sensitive skin micro-lifting. I'm just going to put it right here.
Mm-hmm.
This is your classic, your 7% Jesner. So that's your micro-lifting. So you'll notice these are all liquids.
It's 14%.
That's your 7%.
Did we rip the other one off?
What, huh?
Did we rip the other one off?
No, we don't.
TCA.
This is an enzyme only. There's no acid in it. It's great for sensitive skin. It's really good for doing extraction work because it's very softening on the skin. We use it post-chemical peel to get off the hanging skin cells that have not released. So let's say you do a Jesner or a TCA, then the patient will come back to you on day 6 and you do the herbal enzyme peel. There's no acid in it. It gets off all the hanging skin and they look really clear. The retinol, the one you said that was a little bit active on your hand, the yellow one, the yellow cream, that's a 20% lactic acid in a cream, right? Different than the one that's in the liquid. So it's in a cream, and then it has the 9% retinol in it. So it's super, super high. I use that a lot after dermafrac, after microdermabrasion, after dermaplaning. After even chemical peeling. If I have somebody who has really deep wrinkles in their cheeks, I'll put the chemicals on the skin and then massage the retinol into it. And let them go home with that on like a mask. You have the lactic acid, which is a traditional lactic acid.
Is that the pumpkin looking on the orange?
Oh, sorry.
That's a
The pumpkin is pumpkin. It's different than your clarifying. The clarifying is also pumpkin. This one is a 15%. The other one is a 5%. So also very good for extractions and very good for lightening and brightening. Then you have the lactic and the glycolic. The glycolic is going to go more for congested, acneic skin, hyperpigmentation, very good for bleaching out spots. The lactic is going to go more for dry, fragile, sensitive, congested skin. Lactic does not disrupt the moisture barrier the way glycolic does. Glycolic completely disrupts the moisture barrier. It seeks oil. It eats oil. The lactic does not. So if you have wrinkles, discoloration, lactic. So even in your level 201, you could start a new client. Once you've gotten them through the fundamental introductory phase, you could then take them to the herbal peel. You could take them to a lactic peel. You could take them to a renewing peel. You can take them right up the ladder and keep them in that 201. That 201 level you'll see on your green brochure is the level where we sell series. So we don't sell series at level 101. Those are more one-time treatments. Your level 301 are one-time treatments also. Level 201 is where the biggest percentage of the client population is going to live. Okay, so they'll start. They'll move to 201. They'll go up after a series of 201s. They go up to 301. They come back to 201 peels. And then you can combine that with microdermabrasion and dermaplaning and needling, and all of that can be combined together. So when I look at my estheticians who are producing high volume of business, you'll see it's a 201 facial. So it's a facial with a peel. That's $150 or $165. I think we just went up on our price. And then they add a microderm or dermaplaning to it. So it's like a $215 or $235 session, and it's a 75-minute session. So you don't need to do too many of those a day to be pulling in a great income. Okay, so I've got a bowl of ice water right here, right?
Mm-hmm.
Because when you put these peels on, especially the Perfect Peel and the Supreme Lifting Peel, you just don't know after dermaplaning how they're going to tolerate that.
It's going to turn rip-roaring,
Or they're going to get hysterical, right? They're going to be like, oh my God, oh my God, oh my God. So you've got to be ready to create comfort.
Are you
Some people,
Right. Can't have to have an assistant run and go get something for you.
right. some people are perfectly stoic and it doesn't bother them. They never feel a thing, nothing. Other people, hypersensitive, I would be the hypersensitive type. So you want to be ready with everything that you know is going to create that comfort.
Was that roller in the freezer? Is that right?
Yeah,
That's an ice roller.
How do you clean them in between?
Just Dawn liquid dish soap.
Okay.
Stainless steel, no?
It's advanced antibacterial.
Mm-hmm.
Okay, so you've got your cotton, you've got your roller. Everything is occluded. You've got your peel. Now we're ready to rock and roll. Okay. Now, there's a couple ways you can put this on, but the best way that I've seen it is with these rayon swabs, because they don't hold the product. When you press down, the product comes, it gives the product back. Whereas if you use a cotton, like if I were to use these cotton pads, like most people do, it's not, it doesn't give it back, it holds on to it.
What is that made out of?
So I want you to keep your chin up, your eyes closed, no matter what, okay? And if you have whatever the level of discomfort, we'll ask you between 1 and 10 what you're feeling. And then I can use the hair dryer on Cool Shot. I can use the ice, or I'm ready, right, for whatever. So you want to make sure that you have enough product. And we're going to work pretty quick.
What is that Q-tip made out of again?
Rayon.
Rayon.
Yep, you're going to feel it because you've got dermaplaning.
Oh, girl.
Go to this side.
It's a lot more efficient to use it with that. I like how you put that on.
Me too.
All right. So let's get the hair dryer here.
You want it dryer?
Some cotton things that you use? Okay, with ice water on them.
So giving birth.
Yeah. If she didn't have that reaction, you would not put this on at all. Okay.
You can use the hair dryer.
And you would actually let them go home with that on, not to wash off at all, not even after several. That's what I heard one of them have to wash off after several hours with customers.
So you're taking this off because of her reaction, not because you initially wanted to, correct?
Is that frosting that's happening? A little bit of frosting. You mean turn it off? Is that, you mean that good or?
Oh, you're fine. I'm good. I'm fine, but I'm good now.
Okay.
I can have
How cold is that?
We'll just go ahead and put that on, chest, face,
Done?
also
Yeah.
from forehead all the way down.
All the way down.
And once you get to here,
Oh,
if you want to
it's
take
It's
a
double
big
rock.
swab, you can
Use
do the
it.
chest like you
I
did the
can feel it,
glycolic
but
with
it's
what's
not-
left.
Okay.
I've poured quite a bit there.
Yeah, that's
And then just put the little cotton over this.
We're good. We put
Okay.
lots of cream over it.
Okay.
She's gonna well.
I'm gonna just do it before I go anywhere, so I know I'm not gonna do that.
Oh, wait, don't you have to put, oh,
That's okay?
Yeah.
I know, rule number one. What
What
about
is it?
protective
That's it.
gel?
No, not protection.
You don't have to put protective gel on the
No, no.
eyes and the nose?
I'm not doing a timer. How long do we
Oh,
do
I
this?
probably got it.
It's eventually goes time.
No.
Isn't it to me?
I'm feeling it, but
Whenever we use
it's
the cotton,
big
big cotton, it goes.
Do you use Dermalogica?
No, you would use Rhonda Allison.
All around the outside, and then you're going to work your way into the middle.
Do it like once, or then you wait 5 minutes, and then you ask how you feel, and over
Mhm.
other one?
Mm-hmm.
Look up to
It's
see
off.
that.
You can take it off.
Come around this side. Outside of the face, and then work your way in.
I just want to thank you for a wonderful 3 days. It could have been 4 or 5. I don't want to leave.
Oh.
So thank you so much. I appreciate it.
Well, we'll see you back.
Yes, you will.
Sure, thank you so much, and I had such amazing experience, and I will highly recommend for everyone who want to turn like next level. And I already miss you. I can't wait when I will see you on 5 days training.
Oh,
Thank you
that's
so
awesome.
much.
Thank you.
It's been a wonderful experience. I've met some wonderful ladies. I've gained a wealth of knowledge from a professional that I trust.
Oh, thank you.
And I'm very happy that I have your training, that I feel very confident and comfortable taking these services out to my clients.
And thank you so much. I couldn't have asked for a better instructor. I learned so much, and I'm so excited to bring this to the treatment room.
Yay!
Thank you.
So I would say that I definitely recommend this to all medical professionals. I think that it's so critical to learn the craft of taking care of the whole patient, learning the importance of touch. You've taught me so much, which I think will enhance my ability to care for patients holistically. And so I thank you for that. And this is my first cosmetical aesthetic course, and I couldn't have had a better professor than you. I look forward to our long-standing relationship. I look forward to working with you and learning from you. You have so much knowledge. I humbly bow before you.
Okay, I'm so glad that I made the decision to come take the training with you. You're amazing, and I'm definitely looking forward to taking more classes with you. I'm gonna come back. Thank you so much.
Thank you.
Thank you, Lynn. Those 3 amazing days. You know, like amazing days. The ladies said that it's not enough, right? You want to continue. It's like,
Yes.
we will miss you, and I have learned so much. I've been an esthetician 20 years. I will come back again and again to refresh my memory with her, and she has a lot of knowledge.
Very good.
Thank you.
Thank you. This information is going to empower your career. So if you're thinking about taking your practice to the next level, working with physicians, then I believe this is information that you just absolutely must have. Everyone knows that Institut Dermed is the place you come to gain knowledge and confidence in advanced aesthetic skills. So read the description, learn about the courses, and learn about clinical and medical skincare, and then save your seat. I look forward to seeing you in class.